Hello everyone, and welcome to our channel. It's so lovely to have you join us today. I'm here to talk about something really important for all of us as we get a little older, our medicines. You know, as the years go by, it's quite common for our medicine cabinets to start looking a bit fuller. We might have a pill for our heart, another for our blood pressure, maybe something for aches and pains, and perhaps a vitamin or two. It's all part of taking good care of ourselves, isn't it? But sometimes, with so many different medicines, things can get a little confusing, and that's perfectly normal. Today, we're going to talk about something called medication reconciliation. Now, that's a bit of a fancy term, but all it really means is making sure all your medicines are working together safely and effectively. It's like being the conductor of your own personal orchestra of health, making sure every instrument plays in harmony. We want to avoid any sour notes or unexpected surprises. Our goal is to help you feel confident and in control of your health, making sure your medicines are helping you, not causing any extra worries. Please don't forget to like, share, and subscribe. Understanding your medicines, why it matters. Let's start by thinking about why this is so important. Imagine you're building a beautiful garden. You wouldn't just throw all sorts of seeds together without knowing what they are, would you? You'd want to know what each plant needs, how they grow together, and if any might harm another. Our bodies are a bit like that garden, and our medicines are like those plants. As we age, our bodies change. How we process medicines can be different than when we were younger. What worked perfectly well before might need a little adjustment now. Also, we might see different doctors for different things. A heart doctor, an eye doctor, our family doctor. Each one might prescribe a medicine, and sometimes, without realizing it, these medicines might not mix well together. This is where medication reconciliation comes in. It's about making sure everyone is on the same page and that all your medicines are working for your best health. One of the biggest concerns is something called polypharmacy, which simply means taking many different medicines at once. While each medicine might be important on its own, when you take several, there's a higher chance of them interacting with each other in ways we don't want. This could lead to side effects, or even make one medicine less effective. Studies show that older adults are more likely to experience adverse drug events, which are unwanted or harmful reactions to medicines, often due to these interactions or simply taking too many medications. The brown bag method, your first step. So, how do we start this important process? It's actually quite simple, and I like to call it the brown bag method. It's a wonderful, practical way to get organized. Here's what you do. Gather everything. Go through your home and gather every single medicine you take. This includes prescription medicines from your doctor, over-the-counter medicines you buy at the pharmacy, like pain relievers, cold medicines, antacids, vitamins, herbal supplements, and even creams or eye drops. Don't forget anything that's as needed or that you only take occasionally. Put them in a bag. Place all these items into a bag. A brown paper bag works perfectly, but any bag will do. Bring it to your pharmacist or doctor. The next time you have an appointment with your doctor, or even just a visit to your local pharmacy, bring this bag with you. This simple act gives your healthcare provider a complete picture of everything you're taking. They can then review each item, check for potential interactions, and make sure everything is still necessary and appropriate for you. It's a fantastic way to catch any potential problems before they even start. This method is widely recommended by health organizations because it's so effective in preventing medication errors. What your pharmacist or doctor will do. When you bring your brown bag to your pharmacist or doctor, they'll do a few key things. Review each medicine. They'll look at each bottle and package. They'll check the name of the medicine, the dose, how much you take, and how often you take it. Check for duplicates. Sometimes you might be prescribed the same medicine by different doctors, or you might be taking an over-the-counter medicine that has the same active ingredient as a prescription. They'll spot these duplicates. Look for interactions. This is a big one. Some medicines just don't play well together. They can either make each other stronger, weaker, or cause unexpected side effects. Your doctor or pharmacist has special tools and knowledge to identify these potential interactions. For example, some blood thinners can interact with common pain relievers, increasing the risk of bleeding. Assess for appropriateness. They'll consider if each medicine is still the best choice for you. As we get older, our bodies change, and sometimes a medicine that was once perfect might no longer be the safest or most effective option. They might suggest a different dose or even a different medicine altogether. Discuss side effects. They'll ask you about any side effects you might be experiencing. Sometimes a symptom you're having could actually be a side effect of one of your medicines, and you might not even realize it. Simplify your regimen. If possible, they might suggest ways to simplify your medicine routine. Maybe combining 2 pills into one, or finding a medicine that treats multiple conditions. The fewer pills you have to keep track of, the easier it is. This thorough review is a crucial step in ensuring your medication regimen is safe and effective. It's a collaborative effort between you and your healthcare team. Important questions to ask. You are the most important member of your healthcare team. Don't be afraid to ask questions. Here are some great ones to have ready when you talk to your pharmacist or doctor. What is this medicine for? Make sure you understand why you're taking each pill. How and when should I take it? Is it with food? In the morning? At night? What are the possible side effects I should watch out for? Knowing what to expect can help you identify problems early. Are there any foods, drinks, or other medicines I should avoid while taking this? This is especially important for interactions. How long will I need to take this medicine? Is it a short-term treatment or a long-term one? What should I do if I miss a dose? Is there a generic version available? Generic medicines are often much cheaper and just as effective. Can we review all my medicines to make sure they are still right for me? This is your direct request for a medication reconciliation. Writing these questions down beforehand can be very helpful. Don't feel rushed. Your healthcare provider is there to help you understand. Practical tips for managing your medicines. Beyond the brown bag method, here are some everyday tips to help you manage your medicines safely and effectively. Keep an up-to-date list. This is perhaps the most important tip. Keep a written list of all your medicines, including the name, dose, how often you take it, and why you take it. You can use a notebook, a special medication card, or even an app on your phone if you're comfortable with technology. Make sure to include over-the-counter medicines and supplements too. Keep this list in your wallet or purse so it's always with you, especially in an emergency. The National Institute on Aging strongly recommends keeping an updated medication list. Use a pill organizer. These can be a lifesaver. A pill organizer with compartments for each day of the week and even for different times of the day, morning, noon, evening, night, can help you remember what to take and when. It also helps you see if you've missed a dose. Set reminders. Use alarms on your phone, a special medicine reminder app, or even a simple kitchen timer. Whatever works best for you to remember your doses. Store medicines properly. Keep your medicines in a cool, dry place, away from direct sunlight and out of reach of children and pets. The bathroom cabinet, while convenient, can often be too humid for some medicines. Always check the label for specific storage instructions. Don't share medicines. Never share your prescription medicines with anyone else, even if they have similar symptoms. What's right for you might be harmful to someone else. Don't take expired medicines. Check the expiration dates on your medicine bottles. Expired medicines can lose their effectiveness or even become harmful. Dispose of them properly. Your pharmacy can often tell you the best way to do this in your area. Be aware of new symptoms. If you start feeling unwell or notice any new or unusual symptoms, consider if it could be related to one of your medicines. Don't hesitate to call your doctor or pharmacist to discuss it. Inform all your pharmacists and doctors. Make sure every medical personnel you see knows about all the medicines you are taking, including those prescribed by other specialists. This is where your updated medication list comes in handy. When to seek help. While we want you to feel empowered to manage your medicines, it's also important to know when to reach out for help. Call your pharmacist or doctor immediately if you experience a severe allergic reaction, like difficulty breathing, swelling of the face or throat. Develop a sudden severe side effect. Feel very confused or disoriented after starting a new medicine. Have any serious concerns about your medicines? Consider talking to your pharmacist or doctor if you are having trouble remembering to take your medicines, are struggling with side effects, feel overwhelmed by the number of medicines you're taking, have questions about any of your medicines. Remember, they are there to support you. Don't ever feel like you're bothering them. Your health is their priority. We've covered a lot today, haven't we? From the brown bag method to asking the right questions and managing your medicines day to day. The main message we want you to take away is this: you have the power to be an active participant in your own health. Medication reconciliation isn't just a medical term, it's a vital practice that can significantly improve your safety and well-being as you age. By taking a little time to organize, ask questions, and communicate with your healthcare team, you can ensure your medicines are truly working for you, helping you live a healthier, happier life. Think of it as a regular health checkup for your medicine cabinet. Just like you get your eyes checked or your teeth cleaned, reviewing your medicines regularly is a crucial part of staying well. Make it a habit to do your brown bag review at least once a year, or whenever there's a significant change in your health or your medications. Thank you so much for spending this time with us. I hope you feel more confident and informed about managing your medicines. Remember, you're not alone in this journey. Your pharmacists, doctors, and loved ones are all here to support you. Stay well, stay safe, and keep shining. If you like our today topic, please don't forget to like, share, and subscribe. Till next time, cheerio.